cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na may natapakan pala siya. So probably yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, malit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pacheck na natin yan. So, pinacheck namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang, marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed. Religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa, malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, tinangkap ako siya. Parang nawawala, parang wala na. Hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simple Nature.
Healthy day, everyone. My name is Jhen Lim, a licensed pharmacist and one of your health advisors here in Simply Nature. We are an international distributor of food supplements derived from a unique strain of microalgae known as PPARS, which has been tried, tested, and certified, proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. Now, just a quick recap. Last week, Thursday, we discussed about enhancing breast cancer treatment with integrative care. However, prevention is still better than cure. So, moving on, our topic for tonight is preventive medicine, how to stay ahead of chronic illnesses naman. Let's face the truth. Chronic diseases like diabetes, heart disease, and even cancer don't just appear overnight, diba? They build up over time and often quietly until one day they disrupt our lives. Like, ano tong nakapa ko dito? But the good news, with the right tools and knowledge, we can take control and stay ahead. That's what we'll cover today. So let's dive in. Before we jump into strategies, let's start with the basics. So preventive medicine isn't about reacting to illness. It's about stopping it before it starts. And according to the World Health Organization, chronic diseases account for, mind you guys, 70% of deaths globally. But don't let that scare you. Let it empower you. These statistics are a wake-up call that prevention is more important than ever. That's why our topic for tonight is led by two distinguished experts. It's an honor to present our first esteemed speaker, Dr. Jansen a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holístico, and Simply Healed Medical Group, where he practices integrative oncology. And up next is a seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him. It's no other than Mr. Shyan Lim. So let's watch this.
Hello, good evening, and welcome to another episode of Simply Healed. I'm Jhen, and today we're going to talk about preventive medicine. How to stay ahead of chronic illnesses, and how Simply Nature PPAR protocols can play a part in this effort. Preventive medicine is about taking proactive steps to prevent chronic illnesses from even developing. Chronic illnesses like diabetes, heart diseases, and even cancer. And these diseases are more prevalent now today than ever before. And this is very important because we live in a day and age where pandemics are a possibility. You know, the year is 2025 that we are doing this particular episode. So, you know, there is even a warning that this could be a year where another pandemic will break out. In fact, right now as we are doing this taping, China has a new outbreak of a new communicable disease. It hasn't become a pandemic, but it reminds us how important it is to get rid of our comorbidities so that if ever a new pandemic hits or any contagious disease hits, you will be in a better position and to protect you and your family. Let's take a look at the 3 key strategies when it comes to preventive medicine. We want to focus on these 3 areas. Number 1 is your metabolism. Number 2 is inflammation. And number 3 is energy storage. Yeah, these are probably 3 key factors that you seldom hear when you talk about preventive medicine. Because most of the time when all of us talk about keeping ourselves healthy, it's always about immune system, immune system, immune system. But today we're going to learn something new. It is important to take a look at our metabolism again, inflammation, and energy storage. So let's start. Okay, let's look at the first key area, metabolism. Now, this is very easy to understand why it's important in preventive medicine because one of the most common illnesses that we have today are metabolic syndromes. So that's your diabetes, your high blood cholesterol, which leads to things like hypertension, heart disease, so you get your heart attacks, your strokes, and everything. So these are the chronic illnesses that we face. Now, how does PPAR help with metabolism? PPAR actually regulates, stimulates, and improves your metabolic functions, which means your body burns the energy it takes in through food more efficiently. How is that important? That is important because if you burn the food that you take in more efficiently, creating more energy, you also have less excess energy to be kept. Right? It's like the difference between using diesel versus petrol for your car. You know, when you burn diesel, there's more smoke, it's less efficient, it doesn't burn as cleanly. So excess energy from the body that is not used is actually stored as fat. So you want to burn the food that you take in completely so that it doesn't stay in your body and store in as fat. Now that is important because our body actually functions in a last in, first out method. That means if you ate too much and you have all these excess nutrients and energy and it gets stored, excess calories, and that is stored as fat, and when you take your next meal, the body is not going to burn the fat first, then your new meal. No, it's always going to burn the new meal first, and the previous stored energy as fat stays there. So for any of our viewers who is also interested not only in preventive medicine, but also keeping your waistline trim and looking young and healthy, then this is an important tip for you, right? You got to make sure that the food that you eat is completely burned, completely metabolized, right? So that it will not be stored as visceral fat. Another key component is that we directly impact your metabolism of your sugar. PPAR agonist found in our PPAR series actually makes your body cells insulin sensitive. That means it will prevent you from or help you manage, if you are already type 2 diabetes, it will help you manage your type 2 diabetes, even reversing it over a period of time and allowing you to have normal insulin sensitivity, which means you actually reverse diabetes. And I know for some of us who have had diabetes for a long time, if you were diagnosed with diabetes many years ago, your diabetologist or your doctor will probably have told you that diabetes cannot be reversed, cannot be cured, and that you would have to be on maintenance meds for the rest of your life. Well, that is not true anymore. In the last 2 years, the American Diabetes Association, right? So this comes straight from the Diabetic Association of America, actually put out a journal, scientific statement, right, to say that diabetes can actually be put on remission, right? That means it actually can be reversed, it can be normalized. So there you go. Even the medical science, we understand our body more, and there are, of course, new protocols that come out that can actually treat what could not be treatable many years ago. So we settle with the first key strategy, metabolism. And PPARS work in the area of metabolism by increasing the efficiency of your metabolism, so you'll feel more energetic, you burn your fuel your calories more cleanly and more completely, so that prevents you from building up fat, okay? And last but not least, it makes your cells insulin sensitive. And that's very important to many people because it prevents, manages, and even reverses blood sugar issues like both type 2 and even type 1. Actually, you have noticed as I talked about metabolism, I actually segue into the energy storage portion. So I've already conquered 2 of the key strategies, even as we explain how Simply Nature PPARS actually regulate and stimulate the metabolic pathways. Now I'll go to the last strategy, which is very important. Remember we said 3 strategies: metabolism, inflammation, and energy storage. We've covered metabolism, we've covered energy storage. Now we want to talk about inflammation. Inflammation is really the root of almost all our chronic diseases. Believe it or not, inflammation is also one of the foundational causes for brain disorders. So things like depression, schizophrenia, ADHD, manic attacks, panic attacks, all this, one of the root cause is neural inflammation. That means inflammation of the brain, all right, or the cells in the brain. So that is important. So inflammation also affects your gut. So if you are highly inflamed, it affects your gut functions. This has a direct impact on your immune system. On another episode of Simply Healed, we'll talk about how your gut makes up almost 70% of your immune system. Many of your immune system cells are actually trained in your gut. We won't go into that today, but I just want to let you know inflammation of the gut affects your gut's ability to function, and its role in the immune system is very, very significant. The other aspects of inflammation, you all know, it results in pain, right? Inflamed joints give you pain. Now, chronic inflammation basically wears and tears your body. Okay? It is important that we have inflammation because that's the body's natural response to injury. And it's your body's sort of civil defense. It's like the ambulance, the fire trucks, all swarming to an area where there was a disaster. That's what inflammation actually is. But in today's world, we all suffer from chronic inflammation. That's because of our dietary patterns, right? Our lifestyle habits. It makes us chronically inflamed. In fact, one of the effects or long-term effects of COVID-19 is chronic inflammation. And that is why many people will have noticed, right? If you've ever had COVID-19, and I believe almost every one of us has had, 1 or 2 bouts of COVID-19. After that, we seem to be more easily fatigued. Also, heart disease and issues are on the rise because inflammation has a very direct impact on the health of your blood vessels. If your body is chronically inflamed, it's easy for the blood vessels to become clogged, built up along the blood vessel walls, and hardening of the blood vessels will be part of that inflammatory process. Okay, and also inflammation feeds cancer. So on Simply Healed, we always talk about cancer. Now, it's important to know how inflammation feeds cancer. As we talked about, in cancer, you want to have your immune system. Now, if inflammation affects your gut, and your gut is where your immune system is trained and nourished, then with a weakened immune system, it affects your ability to fight cancer. Next, right, inflammation brings a lot of blood to an area. So if your body is constantly inflamed, it makes it very easy for the tumors to get their nourishment. It's also an inflamed body also makes it easy for the forming of blood vessels. So tumors need to form their own blood vessels in order to grow in size. So basically, as long as you have an inflamed body, it is a fertile ground for cancer growth. So an important cancer strategy is to reduce chronic inflammation in your body. So again, inflammation is a root cause of almost every chronic disease we have, from heart disease to even brain disorders. So Simply Nature PPARS specifically will trigger the pathways that regulate and modulate inflammation. So it will, over time, even with our Simply Nature PPAR tablets, reduce your chronic inflammation. And this is very evident in people and patients of ours, clients of ours that have joint pains. By simply taking soft gel capsules and even tablets, if your pain is mild, you will see the reduction of inflamed joint pains. So from gout, okay, to psoriatic arthritis, to normal arthritis, you will see inflammation being reduced, and the evidence is the pain and swelling subsides. Okay, so that's the very fast and obvious way how Simply Nature PPAR demonstrates its ability to modulate and reduce chronic inflammation. So, okay, we want to keep it short because I think this is just seeds, okay, for the most important segment of our weekly program, which is the Ask Me Anything segment. So I hope I've given you food for thought. It is important in terms of preventive medicine. Think about metabolism, how your body stores energy, and most importantly, all right, how do you manage inflammation in your body? So it's not just about taking vitamin C and antioxidants. There's a lot more. You've got to trigger the body's and inflammation modulating systems, and that's specifically what PPARS does. So with this, let's move on to our AMA, and we'll answer any questions you may have on today's topic or anything you may have on any health issues in your life. See you in a while.
Thank you for the comprehensive discussion from our PPARS expert, Mr. Shyan. Now, it's time for our much-awaited live AMA or Ask Me Anything portion to answer your questions in this modern world filled with noise of different health opinions. Trust the ones from the experts. Let me call back on Mr. Shyan and Dr. Jansen.
Hi, Jen. Hi, Doc.
Good evening po, gentlemen.
Good evening. Good evening.
Hello, good evening to all of you guys. Hi.
Doc, Chinese New Year next week.
Coming soon.
Yes.
Joy. How will you be spending your New Year's? This will be the first New Year's. Grace will be in Manila.
Yes. Well, we just have a small family gathering and eat out. That's all.
Okay. Jen, and a happy Chinese New Year to everyone, because next week, the next time the program comes on, Chinese New Year would already be in season. For those of you who do not know, Chinese New Year is actually how many days is Chinese New Year? Dr. Jansen, do you remember? I forgot. Oh
I
my
have
God.
no idea. I have no
Yeah.
idea. For us, it's just one day.
No, it's more than that. Chinese New Year is, I think, like 16 days. Yes, correct.
Wow.
It's actually 16 days. All right. That's why it's the biggest holiday in China. They will have the world's longest traffic jam also. People get stuck in the traffic for days. Yeah, days, not hours, days. Because everybody in the cities will be going back to the province. Yeah. But maybe now with all their speed trains, bullet trains, things are better. But yeah, that's how it is. And it's almost a month-long holiday in China. So it's a big deal. Okay, sorry. Let's go. That's just general knowledge for everyone about Chinese New Year. So let's go to our questions, Jen.
Yeah, I hope that will not make their excuse to binge eat because it's holiday for 16 days.
Yes, you are right. 16 days of binge eating, huh? Yeah.
Okay, let's go down to the first question coming from Facebook. Miss Yan Go. How do PPARS help reverse diabetes?
Doc, you want to take this?
Yeah.
Medical understanding. Yeah.
Yeah. So the mechanism of action there is PPAR agonists help reduce insulin resistance. So they act on different receptors, no, to improve insulin sensitivity. So by improving insulin sensitivity, then blood sugar would come down much efficient. Okay, so you would be able to use your fuel, which is sugar, more efficiently. So that's basically the main mechanism of action. In fact, no, Simply Nature PPARS is a microalgae supplement. There are medications such as pioglitazone. These are PPAR agonists as well. Okay, but it's pharmaceuticals. No, Simply Nature PPARS is a nutraceutical. Okay.
There you go. So I think one of the most important thing to note is that the mechanism of action for PPARS will not cause you to go hypoglycemic. So that means no matter how much PPAR tablets or extracts you take, for example, you're taking it for diabetes, you don't have to worry that your blood sugar level will go too low. This is not the case for diabetes medication. That's why always follow your doctor's dosage and direction when you're taking any form of medication. For example, if you take too much diabetic medication, you will actually have hypoglycemia. So your blood sugar level will be too low and you can actually faint from that. So that will never happen with Simply Nature because, as Dr. Jansen explains, it simply makes your cells behave like normal. So your cells will actually know how to when to stop, all right? When to stop. So you will never be low blood sugar with Simply Nature PPAR protocol. So that's one of the safety, I guess, benefits when on this protocol.
Before we move on to our next question, let me just acknowledge the presence of an angel sent from heaven here on earth, Miss Janet Koo. Good evening po.
Hi,
Okay,
Jenna.
Okay. Next question, another from Metabolic, from Miss Carly. Can hypertension be cured or are they only manageable?
Wow.
Okay. Let me get this straight.
Take this one. This is a very interesting one.
Hypertension is a condition. It's a condition. It's not really a disease. Okay. So there are lifestyle factors. So there are risk factors for you to develop hypertension. And hypertension in and of itself is a risk factor to develop other diseases. Okay. So hypertension is a condition. So by definition, hypertension is a blood pressure of 140/90. Persistently 140/90. Okay. So hypertension is managed, but it can be reversed. Okay, with the proper lifestyle changes. Okay, so if you are doing bad health habits, eventually you can develop hypertension. And once you have hypertension, it is necessary for you to be on medication, anti-hypertensive medications. So if you don't change your lifestyle, it still remains the same. The blood pressure medications would just increase in dose and increase in number over time. Okay, sometimes over time means 5 years, 10 years, 20 years, no? But that is 100% sure. No, if you don't change your lifestyle, your medication will grow in number. It will go up in dose. Okay. Now to reverse hypertension, you have to change your lifestyle. Okay, and once the necessary lifestyle habits are being done, eventually your blood pressure would be better. So the medications would now be you would be weaned off the medication slowly. Yeah, so it's managed.
Yeah, I mean, I can attest to that. One of the causes of hypertension is not enough sleep, and that's something I'm guilty of. Yeah.
Okay. I was praying thankful Sir Shyan didn't say the cause is us.
Yeah, thank you, Jhen.
Okay. Next question from Miss Arlene. Can children develop chronic illnesses or are they mostly for adults?
Oh, that's an interesting.
Yeah, for children, if the disease condition is is for a very long time, for a very it's present for a very long time already. Chances are it's congenital, so it was there since birth. Children, chronic diseases are very rare in children. Okay, in healthy children, it's very very rare. Okay, on top of my head, I think it's just allergies that allergies. Aside from allergies, what else? Yeah, I can't think of anything right now, but allergies. So aside from allergies, usually it's congenital.
Now, can children like develop high blood cholesterol? Because now we have pictures of children. They look like the Michelin Man. Very round. Can I
Yes,
see,
they
like,
can.
children, like
They can. Yeah,
maybe
yeah.
10, 11 years old, if they eat too much fast food? Is it possible?
Yes, it is possible. If you go on the internet, you would find pictures that shows this, no? But usually, aside from overfeeding, there is a problem in genetics or the gut microbiota. So this can happen in the pediatric age group, no? But more often than not, uh, if a child becomes obese, it's usually from overeating, giving them too much junk food. Okay?
Yeah.
So the genetic part is just a small portion.
Wow. So for everyone, don't overfeed your children, right? Don't indulge them in every one of their cravings. Yeah.
Okay, next question. I think most of our viewers now are moms because the next question is from Ms. Marilyn. Can chronic illness be passed from parent to child?
Oh, that's interesting.
Recipes can. Recipes can. Um, this question is actually a very good question, no? Chronic conditions it's a very general term. So I cannot say yes to this question immediately because chronic illnesses can be lifestyle. It can be from the environment. Yeah. So you have to rule out these factors first to know for sure if what the child has is purely genetic or congenital. Yeah, because sometimes, say for example, allergies, it can be because of chronic exposure to allergens, no? Like your pets, dirty rooms, dusty rooms, molds as well. So these things, no, can happen, especially here in the Philippines, where it is very very humid almost every single day of the year, and yeah, so we have to clean our room, and the quality of our air is not that good, right? So those are factors as well.
So basically, Doc, here's another one. If I have high blood cholesterol and diabetes, does this mean I introduce diabetes into my family tree, right? Because cancer can be introduced by the first person in the family to get cancer. Now, future generations are prone to cancer. So is it the same for chronic illnesses, like the common ones like diabetes, high blood cholesterol, hypertension?
Yes, it can. It can be. There are genetic factors as well that can influence the occurrence of these to become hereditary. But these factors, the influence is quite small. It's still
Okay.
the environmental and the lifestyle factors that has the most influence, whether or not an individual develops one of these diseases.
All right, all right. Doc, it is very important, right? These diseases that we're talking about, diabetes, high blood cholesterol, they don't kill you immediately, and most of us think it's okay, it's okay. But honestly, how dangerous is it? And from your personal point of view in our world today, I mean, like especially like for example, COVID. If COVID didn't come, we won't care too much about our diabetes. But those with diabetes and when they get COVID, their chances of dying from COVID is like 10 times more than a person who does not have diabetes. So how important is it for us to deal with our chronic illnesses?
It's very, very important because nowadays it's easier to. Nowadays it's quite easy to do bad or unhealthy behaviors. And yeah. So say for example, no, office work. So you're seated all day. It's very easy for you to develop a sedentary lifestyle. And if you're sedentary, you're not exercising. Well, guess what? Your chances of getting heart disease, stroke, becoming overweight, developing diabetes, developing cancer goes up. And just here in the Philippines, the diseases that I have mentioned would comprise the top 6 causes of death of Filipinos. If you Google the top 10 causes of death of humans around the world globally, you would see the same diseases. Okay, yeah. So in general, no, taking every single country on average, okay, it's quite easy. It's quite easy, and with all the processed foods that we have nowadays, it's very easy to just get that canned tuna and or corned beef, heat it up, then eat immediately. So a lot of processed stuff already, which would of course promote diseases. Of course, there are countries wherein you don't see these conditions, diseases, so that we are so that seems to be very, very common in our society, in the society that we live in. So one example is in Vietnam. Currently, it's very uncommon to see a person who is obese or overweight.
Yes, that is true. If you see most Vietnamese ladies and guys, they are very slim. Yeah.
Yeah, same thing with Korea, Japan, in China as well. It's very uncommon to see a person who is overweight or obese there.
Yeah,
even in Taiwan.
Yeah, I think in China it is the rich people that are overweight.
Yes, because of they have riches
so much
already. They
good
can
life.
just eat, indulge, right?
Yeah, but you're right. I think the average Chinese, it tends to be on the more slim looking. Yeah, correct.
Yeah,
correct.
exactly. So you would see these patterns, no? And it's very good to learn from these countries, how they live, how they nurture their children, how they teach their children uh, to make healthful choices, and how easy it is for them to choose choose to be healthy, to eat healthy. It's because it's natural to them. It's who they are. So here in the Philippines, there's no such thing. I mean, Filipinos live on sugar and salt.
Yeah, it's true. It's true. Yeah. Yeah, you can just ask Miss Jhen, Miss Jhen lives on potato chips.
I was just watching Gordon Ramsay came to the Philippines a week ago, I think. They did this halo-halo challenge, and there's one participant, Ninong Rai. Ninong Rai is a influencer, YouTube influencer who cooks, right? With added humor. And it was so funny because when he prepared the halo-halo and Gordon Ramsay tasted it, it was too sweet for Gordon Ramsay. I think Gordon Ramsay was saying his arteries are jamming up.
Really,
But
really.
yeah, yeah, but I mean, if an average Filipino tastes what I mean Ninong Rai prepared, it
To be
might
normal.
be just enough for
That's
this.
nice, right?
Yeah, I mean, yeah, I mean, I won't be surprised because there are,
Yeah.
Filipinos really live on sweetness and saltiness.
And I think that Filipinos are not dying from metabolic syndromes. I really suspect this. I think Filipinos are very happy people, and I think somehow that has helped Filipinos survive all these diabetes and high blood cholesterol. I mean, that's just my that's just my 2 cents. Yeah.
Okay.
Okay, Jen, next question.
Yeah, since this is Ask Me Anything, here's our first cancer question from Facebook. Lynn Cordero, can PPARS help with metastasized cancer?
Yeah, it definitely can. For stage 4 cancers, no, it is a must that you have a systemic treatment, and usually, if you go to an oncologist, the answer there is chemotherapy, targeted therapy, or whatever therapy. No, they give you some medication, some molecules, no, and of course, one concern is would be the side effects, and definitely PPARs can help with managing the side effects. The side effects would be there. Don't get me wrong. You would feel the fatigue. White blood cell count would go down because it's chemotherapy. But the white blood cells, the number of white blood cells, no, the white blood cell count, if it goes down, it won't be too much. And if it goes down and you need filgrastim or a medication or an injection to help increase the white blood cell count, the dose won't be too high. 1 or 2 doses would be enough. So usually, with my patients, if they do require filgrastim injections, it's just 1 dose. And sometimes we do see cancer patients who are on 3 doses, 4 doses, no, really high, and multiple injections at that, just so their white blood cell count goes up. So it's easier. And I can say that in this way, PPARs can really do help with cancer, with the treatment for stage 4 cancer.
I think I just want to add that if your cancer has metastasized, by definition, is minimum stage 3 and most likely stage 4. So in that late stage cancer, you just want to do as much as you can, right? As much as you can. So you will use the most aggressive conventional medicine as you can. That will probably be chemotherapy. And at the same time, you want to take the best natural supports and supplements that you can. So you want to have an appointment with Dr. Jansen so that you can consult him about lifestyle changes from the foods that you should eat, from the things that you can do on your daily life that will support your fight against cancer. And on the supplement front, I really very convicted that Simply Nature liquid extract and powder extract will be the foundation. It's something that was going to help you with your chemotherapy, your radiation therapy, and even your immunotherapy. But at the same time, it helps with your comorbidities. It does directly have an impact on your immune system's ability to fight cancer. So it's like the best supplement that you start with that is like therapeutic in its effect, right? And on top of that, you're going to add all the advice from Dr. Johnson, from taking, for example, turmeric, for example, which is really good for cancer as well, things like that. But when it comes to those who are undergoing chemotherapy and radiation therapy, I can't think of a better supplement to start with. All right. And this is what we always believe on this program. Dr. Johnson will be able to share with you other protocols as well, from vitamin C drips to ozone therapy for pain relief, I think, and fatigue. All these things will be added. So if you are metastasized cancer, I think you want to explore every option to help you through this process. Now, also be very careful. Using every option doesn't mean you go to, for example, buy every network marketing product out there in the world, right? Then you are also in for, you want to take things that are proven and with people that will stand by the protocols. For example, like us here, we're always here. We've been on for 200, how many episodes, Jhen?
This is the 195.
195 episodes. That means we've been going on for almost 4 years without a break, right? So you want to get protocols and seek treatment for people who will be there with you throughout the journey, so that along the way, for sure, you're going to have questions. There might be complications. There might be good and bad turns in the fight against cancer. So you want to have a good support and a stable support, and not just something that you buy and then, yeah, no one to answer your questions. So that's really important. Jhen?
Since you were mentioning about the recipes earlier, Doc, there's a question from Miss Annie. Is shirataki rice really a good option?
Shirataki rice is I am not I can totally answer for sure no shirataki rice, because shirataki rice is not a true rice. Yeah, they use another vegetable to create that. If I'm not mistaken, it might be corn, no? Let me just check shirataki or mushroom.
Oh, it's mushroom rice. Oh, wow.
Konjac rice, yeah, konjac rice. It's a rice substitute. So shirataki rice is should I say genetically modified?
Okay.
But it's okay. There is no plant that naturally produces shirataki rice. It's processed by humans.
Okay.
So if you want whole grains, okay, if you want whole grains, go for the brown rice, red rice, black rice, no? Oats. Corn is also a whole grain. Okay, so go for those. If you're in the Philippines, those are the common ones. If you're abroad, and if quinoa would be more available to you, Wesley, so barley as well, no? Okay, not the barley powder, the barley with the grain. Okay, so those are whole grains. Okay, so you go for those foods instead.
Doc, in Philippines, there's this special rice that I ate before. It's quite interesting texture. It sounds something like what pilai or something like that. It's like white in color. It's a local grain. Okay, it doesn't sound familiar to you. It's like something pilai.
Yeah, it's not familiar. It's not
Okay, never
familiar.
mind. If anybody on Facebook knows what I'm talking about, just type it into the chat box, okay? Yeah, thank you.
Okay. Is it palay, sir?
Yes, palay.
It's rice.
It's just general term for rice.
No. There's something like it's flatter. It tastes very light.
Adlay?
Huh? Yeah, adlay. Correct, adlay. Are you familiar with that, Doc? Adlay.
Yes, adlay. Yeah, it's familiar as well. There are a lot of patients who are also asking if this would be good.
Yeah.
Now, this is to answer, no?
Okay.
Whole grains in general would be good for diseases like metabolic diseases, no? Like high blood sugar, high cholesterol, hypertension, all whole grains. May it be shirataki or adlay or whatever rice. But if we just look into cancer, I haven't seen any medical research studying shirataki and adlay. The medical research is always on black, red, and brown. And among these three, it's the red rice which has the most anti-cancer effect.
Wow. Okay.
But, however, take note, yeah, take note of this. The study that I am referencing, no, did it in vitro. So by in vitro, this means that they found the anti-cancer effect on a petri dish. It's not on humans, not on human studies. Okay, so why am I recommending still if it's an in vitro study? It's not clinical, because you're gonna eat. might as well you eat something that we know there is some degree of anti-cancer effect, rather than you eating another food which we don't know if it has anti-cancer effect, if it's harmful or what. So that's why I'm still pushing it. That's why it is included in my list of foods, no, that I advise for cancer patients to eat. Okay? So there's an exception though. For in vitro studies, it would still be effective. I think, no, this is just my opinion, but I think it would still be effective if the cancer is along the gastrointestinal tract, because the food that you eat would bathe whatever tumor is along that tract. So that's why I still include this, even if it is just in vitro studies. So in vitro studies are just to prove that the hypothesis is true. So example, would adding salt to cancer, would it destroy the cancer or help it grow? So they do studies on petri dishes first. So they get tumors, cancer cells, then put on whatever they want to study on it and see how it works. So it's not on humans. Okay, it's just they take out the thing that they want to study on, then they put the sample on the thing to see any effect. It's just to prove the theory. All right. So this is one of the in the hierarchy of medical research, in vitro studies are at the one of the lower ranks.
Yeah. All right, but this is still red rice, your best shot if you want to choose the healthiest rice for cancer, right? Yeah. All right.
Okay, before we move on to our next question, let me just greet one of our avid viewers, Miss Mav Sagot. Welcome po. Okay, next question from Serene. How can PPARS help stroke patients?
For stroke, the problem there is hypertension, high blood cholesterol. If you have diabetes, that's also going to be a problem. So again, well, PPARS can help reduce the cholesterol levels. It can help you with your fatty acid metabolism, reduce inflammation overall inside your body, which I think inflammation is the most important one that we have to really lower down, no? Which Simply Nature PPARS can really help. Yeah.
Yep. For me personally, I have a good friend, Singaporean, Indian, who suffered from a stroke. And his stroke is not because he's unhealthy. His stroke actually directly came from stress, right? So I've shared this story before. His company was undergoing a hostile takeover. So he was very stressed and he actually passed out getting out of the car in a parking lot, in a parking. And he had a stroke. And his whole half his body was paralyzed. And half his body and waist down was paralyzed. So he was like that, you know, or really like that, you know. When I saw him, I was shocked, you know, because normally he's such a go-getter. The doctor said that he would not likely be able to walk normally again. Here's the very encouraging news. 1 year later, he was actually back in his office. He had to be on a cane. He had to walk. He had to use a walking cane. He could speak. There was slurring in his speech, but his was not like that anymore. It was normal with a slight curve, but he could speak. And he didn't there was a slight slur. Now it's been years. He actually wrote a book on recovery from stroke, right? So he actually wrote a book and became like a spokesperson for stroke recovery. Now, one of the things that he did was throughout the whole process, he, especially in the first 2 weeks to 1 month, he was on liquid extract. And that actually helped with his recovery. It helped with, I guess, the mechanisms is what Dr. Jansen was highlighting, you know, especially the neural inflammation part. There's also a lot of research that you can Google on PPARS and stroke. I think if you take it quite, that means in the same day or actually literally hours after you had a stroke, it helps with neuroplasticity. I think it helps your brain to rewire and to also minimize the damage done during a stroke. So from my personal experience, And of course, as what Dr. Jansen said, helping with cholesterol, the inflammation part. I think that's really important. We underestimate what inflammation can do to your body. Everyone, COVID-19 basically kills by chronic inflammation. Almost all the organs and in your body gets inflamed. And that's what they notice in the autopsy of COVID-19 patients. Okay, so, and after that, long COVID is basically, again, very more serious chronic inflammation. So yeah, that's my personal experience with friends. Of course, we don't actually specialize in stroke victims, stroke patients. So this is as much as we can encourage you with.
Okay, next question coming from our website from Miss Rosida. Hi, may I know if Simply Nature PPARS also help to fight off virus?
Yeah, it improves our immune system, so definitely it can help with virus. I mean, I think Simply Nature has a sponsors an HIV patient.
Yes,
if I'm not mistaken. So
yes,
that's the proof.
Yeah, you can actually look at that on our YouTube channel. It's crazy. It's really an amazing testimony and case, right? Just go and take a look at it. So if it can help, he's not the only one, but he's the one that is like really amazing and recorded and detailed. All right. I've heard of cases of like not direct. That means I never got to speak to the patient, right? About how it improved the quality of life of a HIV patient. But because HIV patients are always very, how shall we say, private. They don't want to let anyone know. It really impacts the life of their life and their family's lives. So yeah, but we have this particular one. The patient flew down with his family member from the province to Manila and actually did a taping with us. Of course, we shot them from the back so you can't see their face, right? And their voice was distorted. But yeah, the patient actually came down. So he was suffering from what's that called? Stephen Johnson. Yeah, so he had a very adverse reaction to the drugs that he was taking for HIV. But within like days, everything normalized and his CD4 count actually increased. That matters a lot. How would you describe CD? How would you define CD4 count? What does that tell, Doc?
CD4, it's an immune. It's a subtype of T cells. So your immune system, you have different soldiers. So one of them are T cells. So T cells have different functions. They classify T cells further. I give you an example. So you have your armed forces. So you have your Navy, you have your Air Force, you have your Marines.
Yeah.
So say for example, under the Navy, you have your admirals, your captains, your sailors, and there are workers who have specific tasks to manage, for example, a ship, a battleship. So these are very similar to your immune system. So your immune system have basically your lymphocytes and leukocytes. Okay, so under these main branches, you have further subtypes, and the subtypes, say for example for lymphocytes, you have your T lymphocytes, you have your B lymphocytes, B as in beta. Okay.
Yeah.
So under the T lymphocytes, the B lymphocytes, you have further subtypes. Okay, one of the subtypes of T cells, would be CD4 T cells. So in HIV, that's the subtype of T cells that gets destroyed. So if the white blood cell counts are quite low already, we usually test for CD4 T cells. And response to treatment, we also use CD4 T cell counts, to see response to treatments and the prognosis of HIV patients.
So for this particular patient, his CD4 count actually increased, and all the doctors were quite shocked. And they knew it was clear that it's PPARS because Stephen Johnson syndrome is when a patient reacts adversely to drugs. So the patient was taken off all other drugs that were only on Simply Nature liquid PPARS, and wonderful. And the patient is now back to his normal life, you know. So that's one, yeah. Thank you, Doc, for reminding us. If it can help with HIV, I think that's the best answer. Does it help with viruses? Yeah.
Very hopeful. Okay. Before our next question, just a quick shout out to one of our avid viewers, Miss Maria Mins. Okay, next question from Sir Jonathan. Stress is inevitable. What is the best way to prevent it from leading to chronic fatigue? Because even if I sleep long, I still feel tired when I wake.
Yes, Doc, I think it's an important question. I'm also wondering how much of it is long COVID. Is it really long COVID? Or what? Yeah.
Stress. Number one advice, stay away from the stress so you won't be stressed.
Doc, you know, it's almost impossible. Some of us are stressed by our husband and wives, you know, so you can't stay away from that.
my answer there is you might want to reflect on your life. Kidding aside. Stress is an inevitable part of life, no? So aside from birth, death, and taxes, stress is there. One way or another, it would be there. Yeah. Okay, so for stress, my advice is you have to learn how to manage it. If you are on the verge of burnout, a few questions, no, that you have to reflect on. Number one, of course, you have to identify the stressors. Why are you burnt out? Number two, are you in a situation wherein how should I say? Are you happy with what you're doing? Okay, because stress also is an essential factor for you to become successful. There is no successful person that has not been stressed or or burnt out or was on the verge of burnout. Yeah.
That's
So
an
if you want to
amazing-
if you want to be a successful, if you want to grow, you have to live with stress.
Wow.
Okay. Unless you don't want to grow, unless you want to be stagnant for the rest of your life until you die, then it's your choice. I mean, there's nothing wrong with it. There are people who are happy with just with what they have. So the answer to the question, I think, it should be rephrased. No, the question should be, are you happy with what you're doing? Is what you're doing uh, um, pushing you towards your goal in life or what you want to achieve in life? Because if these, well, for me, just me, if these are, not not jive, do not jive together, then yeah, you're gonna feel stressed out. I mean, I have seen some of my colleagues, fellow doctors who are, emergency room doctors. I mean, they are happy with every single day of stress that they are encountering.
I think they find it as an adventure, I think. It's
Yeah, they're happy with the adrenaline. They thrive in that in high stress environment. There are people who are like that, but there are also people who would stay away from such a place. I mean, first few days, 1 week that they're in, I mean, they're gonna. I know. I this is not for me. I'm gonna quit. I'm gonna change careers now. I'm not gonna be a doctor anymore. Yeah. So these things happen to a lot of med students. I mean, one in my batch, in the batch, in my classmates, I've noticed these things. I for one was subject to this as well. No, I had to reflect on what I want to do in life, because of these things. So yeah, and I think that should be the question. Yeah,
Doc,
not really. Yeah.
Doc, so from a supplementation point of view, what's the immediate damage of stress? Is it inflammation again? Is that one of the things? So because if we watch television, there will be advertisement for effervescent drinks, that will help fight fatigue,
Yeah.
because the viewer asked about fatigue. So one of the major causes of fatigue is actually inflammation.
Mhm, mhm.
So taking vitamins or supplements that are rich in
Yeah,
antioxidants would be one way you can deal with
yeah.
stress.
Yeah. The mechanism how stress leads to fatigue is this, no. So if you are stressed, you would burn if adrenaline is high, your sympathetic nervous system is firing. Okay, blood pressure goes up. You're in fight or flight response, no. So you would burn more fuel. You would burn more sugar. Cortisol would go up. Cortisol is a hormone that mobilizes sugar so that your blood sugar would maintain at a very high, not very high, but it would
Manageable.
be elevated sufficiently so that it can fuel your activities, no, the metabolic requirements. So as you burn more fuel inside the cell, no, you have your mitochondria. So that's the powerhouse of the cell. If you are in stress mode, okay, the mitochondria will create more ATP. And in that process, ATP is just the energy currency of cells. No? So during the process of generating more energy to make things happen, to move things, no? You would generate free radicals. And the free radicals will damage the DNA. It will create inflammation as well. So in this case, no, you would need your antioxidant, the body's antioxidant reserves. So one would be the enzymes necessary to eat up the reactive oxygen species that generates the free radicals. You would also need the glutathione. And once these are vitamin C as well. Vitamin E is also an antioxidant. Yeah. So these things. So these would get depleted quite fast. So you have to source antioxidants from the food that you're eating. Vitamin C, for one, you have to source from foods because humans cannot create vitamin C. Okay, so for individuals that have very high stress levels, if you would take a supplement, no, choose a supplement that is a whole food in whole food form. Choose a supplement that has complete nutrition. It has some fiber. It can feed your gut microbiota. It has antioxidant properties. So this is if you would only choose one supplement, okay? So this is how you choose. Okay, if you can top it up with a multivitamin and antioxidant supplement, then all the better. With the appropriate vitamins and minerals with the therapeutic doses available on that multivitamin supplement. Okay, so yeah, this is how I would move forward with it. So if you're burnt out, on the verge of burnt out, so aside from contemplating what you want to do in life, these are some things that I would take so that I have some degree of support. But of course, no, the more important ones would be, of course, your behavior, the choices that you're making. Because if you're at very high stress levels, we tend to choose unhealthy lifestyle behavior. So number one, you would tend to be sedentary. You don't want to move anymore because you're so tired. You don't want to exercise anymore. Number two, we tend to choose high fat foods because it is an evolutionary response.
Makes you happy. That's
it
why
makes you happy. Yeah.
then we'll eat potato chips.
Yeah.
Okay. No,
It's a bad cycle.
to summarize what Doc has shared, it really sounds so the strategy is get a high fiber things that antioxidants so that you deal with inflammation, fiber so that your bowel, your gut microbiome stays healthy. That is so important. It manifests from things like constipation because when you're stressed, right? And you will notice when you're stressed, you have a lot of digestive problems. Right? You get heartburn, you get indigestion and all that. So keeping a very healthy gut microbiome is important because that's where your immune system is also being trained. So guys, believe it or not, going to the toilet, going to the CR is actually very important for your immune system. It sounds weird, but it is the truth, okay? So it's very important. So if you see any sickly person, a person who has migraines, a person is not very healthy, you check with them. They are most likely constipated or have very irregular bowel movements like diarrhea or whatever, right? So this is first thing that you really have to take care of. And in conjunction with everything Dr. Jansen says, it really sounds like PPAR tablets is the best. If you can only take one supplement, take PPAR tablets, right? Then after that, add your multivites and everything else on there. Yeah.
Okay. Thank you, Dr. Jansen, for that personal reflections to ponder about. We still have a chance, guys. There's another new year coming in for our New Year's resolution. Okay. Next question from Miss Bell. Can we prevent diabetes from becoming chronic by just religiously taking maintenance medicines?
Huh?
No.
No. Wow. Okay.
No.
That's
No.
that's a very
Yeah.
good question. And yeah.
Yeah. The maintenance medications for diabetes does not reverse diabetes.
It makes it chronic, right? Because you think
Yeah.
you have it under control.
Yeah. In fact, it makes it more chronic because you live longer. So the longer that you live, it's more chronic.
Yes.
Yeah. So don't take the medicine, you die early. It's not chronic anymore. No, just joking, just joking. For diabetes, especially type 2 diabetes, so the problem there is insulin resistance. So if you have insulin resistance, okay, normally this is what happens. So you eat, right? So when you eat, the food will be broken down into molecules. So these would be turned into sugar. So your blood sugar will increase after you eat. So you have all the fuel inside your blood. No, it has to be utilized by your body. So how does it go inside your cells to be used as fuel? Your pancreas will produce insulin. Insulin is a hormone. No, that will. No, it's a protein. Actually, it's a protein that will attach to different organs, different types of tissue, so that the cells will open up their glucose gate so that they can assimilate the sugar from your blood. Okay, in diabetes, there is a fat inside the cells that's blocking the signal, telling the glucose gates to open. Okay, it's fat, intracellular fat. That's the root cause of type 2 diabetes or insulin resistance. So you have to burn the fat. Yeah. So there are various ways on how you can do it. If we just talk about lifestyle, then just eat less fat, more fiber, move more, drink more water, breathe more. So that's exercise again. Stress less. Yeah. Avoid the vices. It's just that simple. So another problem with diabetes is if you are eating too much. So it's a problem of high caloric intake. So this theory is saying if you are consuming too much, anything that was not burned, would be turned to fat. So if this happens for a long period of time, then you'll get insulin resistance. So in other words, diabetes. So the medications just acts on the different pathways of this, but the medications does not remove the intracellular fats or the fats inside your muscle cells. It doesn't. That's why if you have diabetes, you're on medication. Once you stop your medication, your blood sugar goes up. But if you're on medication, everything is normal. So you cannot stop the medication if you don't change your lifestyle.
But doc, direct, how shall we say, I want to direct doc's answer back to the patient's immediate question, which is, can using medication prevent you from getting chronic? So I mean, for the person who's asking this question, perhaps you are considering the fact that if you take medication, your blood sugar is normal, so you are not diabetic because your blood sugar is normal. No, it doesn't work. It's not that way of understanding it, right? It's more like if you take medication, I know. I give a good example. If you take medication, it's like throwing a towel over over the mud on the floor, right? When there's new mud, you throw another towel. So your floor looks clean because you keep throwing a towel to cover the mud, right? So you think that your floor is clean, but your floor is not clean. Underneath the towel, the mud is there. So actually, guess what? Over the years, do you think you have more or less mud? You have thicker and thicker layer of towels because there's more mud, and then you throw a new towel over it, and there's more mud that comes in. So actually, over the years, your floor gets dirtier and dirtier, but you don't see it. That's what happens when you take medication. Your chronic diabetes is actually becoming more and more chronic. It's in your life. It's just being controlled or covered up, right? It's covered up. Just imagine your dosage for, let's say, metformin or whatever medication you're taking, every year or every 2-3 years, the dosage increase. So can you imagine if you were taking like 3 times the dosage that you used to take 10 years ago? What happens if you stop? Wow, your blood sugar will shoot up higher than you've ever seen it shoot up because you've been covering it up with medication. So back to your question, no, it does not prevent you from developing chronic diabetes. Okay.
Okay. We're almost at the end of the webinar. This will be our last question for tonight from Facebook, Miss Minda Banella. Is Cleansing Plus regulate the bowel movements?
Oh, Doc, can you answer this? This is a very interesting question.
Yeah, Cleansing Plus is made from psyllium husk. No? So psyllium husk is basically fiber. So what it does is psyllium husk is a stool bulker. It bulks up the stool. So the idea is if you take in a lot of fiber, it will absorb water, then it bulks up, so like a balloon. So when it bulks up, it will help bowel movement because your intestine will push it down, your colon will push it down to be expelled. Yeah, so that's basically how how psyllium husk like Cleansing Plus helps you with your bowel movement. So it actually is like a broom. Yeah, it's like a broom that will help sweep away the dirt, if there are bad stuff inside your colon, help you to expel it quite fast. Psyllium husk, no? If you do move your bowel regularly every single day, once every 2 days, then you don't need any additional fiber supplement. I mean, that's just fine. But if you're someone who's constipated, then it might be in your best interest to try psyllium husks. It's just that make sure you drink plenty of water, because if you take in psyllium husks, no, and you are dehydrated, you'll become more constipated.
Yeah.
Yeah, so you have to drink plenty of water so it forms like a gel-like substance, so it can slide inside your bowel much faster and push your stool faster. Yeah.
So Cleansing Plus does regulate or help you have regular bowel movements. You know, Doc, I have a personal friend. She had lazy bowels. So is it called lazy bowel? Yeah. Yeah, lazy bowel. It was crazy. She eats like you and I. She only goes to the CR once a week, but she eats a lot. You know, then I was so surprised because I know if you don't detoxify, if you don't go poo-poo, the toxins build up in your body. And I noticed her face actually walang pimples, very, very normal and nice skin. So I was like, huh? Until one day I saw her wear a backless. Her whole back is like Meron volcano. So the toxins still have to come out one way or another, you know. So it actually came out on her back, right? Lots and lots and lots of pimples. But for her, what happened, Doc, is that she took the Cleansing Plus almost on a daily or every 2 days. Her movement became regular, and then after 3 months, it seemed like her lazy bowel was remedied. Is it because of the cleansing plus she's going to toilet every day? Did it end up training her lazy bowels to move normally again? Is that what could have happened to her?
Mm, no, I don't think so.
Okay.
I think it was her gut microbiota that was
Oh,
fixed. Yeah,
okay.
because psyllium husk it's a fiber, no.
Hmm.
It's also a prebiotic, so it will also feed your gut microbiota.
Oh,
Yeah,
so once your gut microbiota is back to normal, you have
you'll have, yes,
you have
the
better bowel
regularity of
movement and
bowel
you'll be more
movement. Yeah,
regular. Wow. Okay.
yeah,
Okay.
yeah.
All right.
Well,
Jen.
it looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Doc.
Yeah. Thank you for watching, everyone. No, it's January is fast. Becoming February already,
Yeah.
and I think a lot of us are still in the, still want to implement healthful lifestyle choices because of the things that we did last month with the holidays. So I just want to say that you have to be consistent, because with consistency, that is where success comes in. Okay. So if you decided to, implement healthful lifestyle changes, stay on it. Stay on what the things that you're implementing, and improve upon them. Okay, until it becomes a habit. If it becomes a habit, it's very easy to do. Yeah, because you're used to it already. No. Mm, yeah. That would be my final word. So again, I would like to thank all of you for staying with us until this late at night. It's always I am actually quite happy again, always, because our viewership still sustained at high numbers, even if the webinar is this long. So thank you everyone for listening, and I hope to see you next week again. Bye.
Yeah, tonight, I want to, like Doc Jansen, I want to thank everybody. Tonight, we actually didn't talk much about cancer. Our topic is not about cancer, but yet we learned so much, right? So I hope that tonight's program is useful to you. And chronic illness is something very important. Actually, is in all the YouTube channels. As long as you watch YouTube, I think there are so many channels that are talking about how important it is to stay healthy, right? And I hope tonight has been useful, and I'm sure next week, Jen, next week our topic is back on cancer, right?
Yes.
Yeah, so those of you who have loved ones who are suffering from cancer, we'll be happy to answer your questions. And as Doc Johnson said, it's January, and it's almost the end of January already. And the year's is gonna move. It's starting to move. So I'm wishing everybody again a happy New Year, and for those who celebrate Chinese Lunar New Year, very early happy Chinese Lunar New Year to everyone. Enjoy your last bout of celebrations for the month of January or for the first quarter, and let's all get healthy. And we'll see you next week again. Jen.
Thank you so much to our experts, Mr. Shyan and Doc Jansen, for sharing their experience and insights. If you have any follow-up questions, don't worry, we will answer each of them next webinar or via direct message. Thank you so much for joining me today. Remember, your health is your most valuable asset. So by focusing on prevention, you're not just adding years to your life, but you're adding life to your years. And if you're ready to take the next step, check out our website. That's www.simplynature.asia for exclusive promos such as, number 1, get more than 280 pesos off when you buy PPARS powder extract or PPARS liquid extract. And then get a 1 free bottle naman of PPARS tablet when you buy 3 boxes of PPARS liquid extracts that's good for a month. Lastly, get 1 pack of soft gel capsules when you buy a pack of 6. There you go. We hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, January 30, as promised, we will be looking to colon cancer recurrence, early detection, and advanced treatment strategies. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we're always with you from start to healing.